Good afternoon. My name is Tim Lynch. I am your host of Legal Lines. Legal Lines is brought to you by the Massachusetts LGBTQ Bar Association, and we're brought to you live the third Wednesday of every month. If you'd like to call in, please do. My number here is 617-708-3290. Again, 617-708-3290. My guest today, he's appeared before. It's my good friend, Alex Coleman. Alex, how are you?
Good. How are you doing today?
Doing well. Alex not only serves on the board of the Massachusetts LGBTQ Bar Association with me, but is also associated with the Massachusetts Transgender Political Coalition. Be asking him some questions regarding the act for trying to get equal accommodation for transgendered people here in Massachusetts. But I first would like to ask him about conversion therapy, there has been a statute passed in California outlawing conversion therapy, and it was recently upheld by the Ninth Circuit Court of Appeals in the case of Pickup versus Brown. First, Alex, what is conversion therapy?
Well, first I should say that I'm also a clinical psychologist,
Yes,
as
that's
well
important.
as being an attorney, so I'm going to approach it from both perspectives. Conversion therapy is a so-called therapy. So it's called usually by proponents reparative therapy.
Reparative?
Reparative, because it's perceived in their minds, or hopefully, to repair the person from being non-heterosexual or non-gender conforming. So most people recognize it as conversion therapy because it's an attempt to change the person from how they are truly to what other people think they should be.
And this pertains both to people's sexual orientation and their gender conformity.
Right. And now the American Psychological Association has, for many, many years, recognized that this is not perceived to be an effective or appropriate form of therapy. For one thing, homosexuality was removed as a pathological condition included in any of the diagnostical statistical manuals since the 90s.
So when you say pathological,
yeah,
you mean what?
It means that, it's not like you're mentally ill just because you're a different sexual orientation. And at this point, even gender identity and expression is getting reconfigured in the new edition of the Diagnostic and Statistical Manual to sort of recognize that some people are going through dysphoria, meaning that you don't feel good about your gender identity or your gender expression. And that may not be because internally it's wrong for you, but it may be because of how the outside world is responding to you. But that is also moving from a definition of this as a sickness to a range of diversity. But back to the conversion therapy.
I can stop you there. I mean, it just seems to me, society has been moving from blaming the victim, as you would, internalizing these issues and blaming the individual, to then looking at society and saying, we should be more accepting of people being different.
Right. So for example, having a mainstream, or even, I don't want to use I don't want to use majority because a lot of times it's not, but say your race is different or your appearance is different based on your ethnic or racial background. You may even be in the majority, but as a result of that, other people, you run into racism in the community in lots of different situations. Now, in some ways, it's the kind of thing where it's not the person who's the racial minority who has a problem. They have a problem because they're being treated badly, or they're being held back, or they're being ostracized, or they're being picked on or bullied or whatever, or they're not given the same economic opportunities. So but it does impact people in terms of how they feel about themselves and how they relate to the world. It doesn't mean that that's sickness, except in society. And in much the same way, there's recognition that that's the case for people who are gay, lesbian, asexual, bisexual, and whatever, that's not strictly heterosexually normative, and people whose gender identity or expression is different from how people in general conceive how boys and girls and men and women are supposed to look, appear, act, present themselves, behave.
So, okay. So way back in the 90s, the American, what was it, psychiatric?
No, the psychological, we've always been ahead of the psychiatric.
Oh,
no,
okay. Psychological Association determined that being gay or lesbian is not abnormal.
Right.
It's not a sickness. And they've also come to the conclusion that being transgender,
Well, they're getting there.
they're getting there. Okay. All righty. So good. So there is this type of, quote, I'm putting in quotes,
Right.
therapy. That's called conversion therapy, or people who propose a reparative therapy. Right. And exactly what is that?
Well, basically, in its attempt to have people identify the feelings or their sense of self that is consistent with being gay, lesbian, or, I'm just using the general language, it's not so binary as this, or having, being genderqueer, nonconforming, as bad, and to change their behaviors to counteract what they would be inclined to do. So, for example, and this legislation in Massachusetts is particularly focused on minors because they don't even have the capacity to consent on their own. So we're talking about their parents or guardians who are basically imposing this on the children.
Okay.
And whether the children feel that they want it or not, especially as they're older children in terms of adolescence, et cetera.
Okay. So there is a bill pending in the State House
Yes.
on this issue relative to minors. But getting back to what exactly is conversion therapy? It's making people who are making people homosexual. They want them. It's trying to convert them to heterosexual. People who do not conform to their biological gender. They're trying to make them conform to their
Right.
And the way they do that is what I'm getting from you. The way
Okay,
they
well,
do that is to
there are a
make them feel
variety of
bad.
different ways. And without getting into the fine details, but basically a lot of it's behavioral therapy.
And what is that?
Behavioral therapy is an attempt to modify your behavior. So basically, it will be to have the person say, you're going to stop dressing this way, and you're going to start dressing this way. And it may be gradual, it may be, less gradual. There are lots of different ways of doing this therapy the same way there are lots of different ways of doing other kinds of therapy. But a lot of the focus is on changing the behavior and internalizing, that means taking in for oneself, the perception that who you are is bad. Yeah. And that you don't need to be that way, that you have control over that, and you can choose not to act on that, and that by changing your behaviors, that reinforces that you don't have to be that way. And that behavioral change is not cognitive therapy and behavioral therapy, attempting to help people change behaviors. That is perfectly well recognized and accepted and is very useful in many situations. But changing one's innate sense of self in terms of your sexual orientation, your gender identity, and your gender expression is it's not something that's going to change. One, it doesn't work. And it may, in the short term, the person may conform and go along with it, but ultimately it ends up backfiring and makes the person feel worse about themselves because that is how you're wired.
So all right, there's two different general fields of therapy. There's the behavioral, which basically tells people this is the way you're going to behave from now on. And then there's cognitive, which...
Well, cognitive and behavioral go together. It's how you think about it and how you act about it.
Okay.
But then the other part of it is getting the message that there's something wrong with you that needs to be changed. And that's the part that's the most damaging. And it also does not work because sexual orientation and gender identity are not, except under very, very extraordinary circumstances, environmentally determined. They're determined by who the person is. And that's why it's ineffective, because people are how they are. Now, one can choose. So, for example, a person who is an adult who, for whatever reason, believes that it's not as good to be gay or lesbian as it is to be heterosexual, that they don't want to be how they are. They can choose to only engage in heterosexual relationships or no relationships, and they can try to do that. But what almost always happens is that it may work for a while. It's not usually fair to the other person that they're in a relationship with.
No, I would think not.
And they're not being their true, genuine selves. And that's the sad part, is that people, who have so much promise and who could, but for the fact that other people are unhappy with who they are and how they are, they have so much to offer. And this is a way of interfering with that. And what it does when you sort of are sort of taught that who you are is bad, we take that in, and that leads to increased depression, because not only are other people maybe treating you not so nicely because of it, but the internal message is there's something wrong with you, and then you feel like you're disappointing your parents if you're a child, or your therapist, or whatever, by not going along and being this new person who you're not.
So so the basic underlying theory here of whatever therapy is that a person has control over these issues.
Correct.
And that's the fallacy.
Correct.
A person doesn't have control over these issues. And when you perform these types of therapies on people, you cause them tremendous internal turmoil.
Right.
You cause the tremendous depression. Their self-esteem, I imagine, goes down because who they are and the way they behave, they're internalized as being wrong. So not only do they deal with society at large, which is problematic many times for these people, but now this therapy comes along and internalizes that even more so.
Correct. And what's also difficult is that, a lot of times people, even well-meaning parents, might say, this life is really going to be hard for my child. If there's a way to not have it be so hard, I'd like to put the child through the kind of treatment that will make life easier in the long run.
Yeah.
And
or doing it for religious reasons.
I mean,
so, a lot of parents do. I've known parents who've done that.
Right, and that may be because they believe that it would be better for the person the next life or whatever. I mean, so sometimes I'm a little less convinced that is always well-meaning. That sometimes I feel is more pressure from even outside the family, but even when it.
But even outside, all these people are well-meaning.
Right, exactly. Oh, absolutely. Right, absolutely. And but instead of